You mentioned a feeling of anxiety, and I want to know about that. Tell me what you're feeling in that regard.
Right now, or how I always
Now,
pretty much feel?
yeah, everything we're going to be doing today is focused on here and now, right now.
Okay. It's just a lot of tension, and I just feel that any minute I'm just going to fall apart.
Okay. Where do you have that feeling the most? Where in your body do you notice that?
Probably more in the chest area.
Okay, so you're pointing right now to where you're noticing it the most.
Yeah.
Okay. Is that the most predominant physical sensation you're having right now?
That along with fear. It's just fear, and I can't describe it. It's just fear beyond belief, and I don't know where it comes from, how to stop it.
Where do you feel it the most? Where in your body does this fear live?
Probably in the same area as the anxiety, just in the chest area.
Okay, all right. Where do you have pain right now?
All in my shoulders, sides of my neck, and some in my back, but it's in my chest. It just feels like something's sitting on my chest all the time.
Okay.
With the back of the neck, up to about the base of the skull, there's pain.
Mm-hmm. Do you have an opinion about your breathing right now?
Opinion about my breathing? Well, it's... I can't say I'm short of breath, but sometimes I have to think about it, because it feels like maybe it's hard to get a deep breath.
Okay, so right now, does it feel that way?
A little bit.
Okay. If you could get a deep breath, where would you feel the relief?
I mean, probably in the chest, just the chest area.
Okay.
Yeah.
Do you have any feeling of tightness in your throat right now?
Yes. I always have tightness in my throat. It always feels like there's something in there.
Okay. Can you point to where you're noticing that?
In my throat? Well,
Okay,
just right the base of the tongue.
Okay, take a swallow. And then... Okay. Do you have any opinion about how it feels to swallow water, just like you just did?
No.
Never really think about it. No reason to think about it. You know, I have done nothing to take away that sensation that you were feeling on the gum, so we're going to deal with that later. How does that feel?
It just went right down. That was strange.
How does it normally go down?
Well, it usually goes down, but it wants to stick to whatever's down in there. It's almost like there's a bigger opening for it to go down. Because I know when I eat food or whatever, it seems to get stuck sometimes, and I have to drink and gargle or, try to get it loose so that I can get it swallowed.
What about your chest?
It's not as tight.
And you had something going on the back of your neck?
Yeah, the back of my neck is always sore and stiff up to about the base of the skull.
How does it feel right now?
Well, I don't feel as much stiffness. It just, even the shoulders feel a little bit more relaxed. I mean, I can still feel pain, but they feel a little bit more relaxed.
Okay. Tell me about your chest. What are you noticing right now?
My chest is a lot lighter, and I don't have near the pain in it.
You described earlier this tremendous feeling of fear.
Right.
Tell me about that now.
I can't say that I feel the fear now. I mean, there's some there, but it's not overwhelming.
Before, how was it?
It was really elevated. It's just the fear that you don't know what it is, you don't know where it's coming from, you don't know what it's about, but you know it's there, and it just feels like it's just going to collapse you any minute. It's going to get the best of you, and it's just like I constantly fight it.
And right this instant,
I'm not fighting it right now.
explain to me what the difference feels like.
What's the difference in the fear? Well, right now it's more, I don't want to say apprehension, but I mean, I can still feel it.
Where does it live right now?
Pretty much in the chest.
Still in your chest, okay.
Yeah.
So what I'm hearing you say is that and you stop me if I'm misspeaking, I don't want to put words in your mouth. What I'm hearing you say is that when you feel the tightness in the chest and this pressure and difficulty in breathing, that is when the fear is present. Is that right?
The fear's always present.
Okay.
Always.
Okay.
Sometimes it's worse than others, but
Okay.
it's always there.
It's always there. Along with this tightness in the chest and the pain in the chest.
Right,
and
that never goes away.
Okay. And the way it is right now compared to normal is?
It's a lot less.
And there's still some.
There's still some. My breathing is a lot better. I don't have a heaviness in my chest that I did. I feel lighter. I'm not having the pain in my shoulders like I was. There's some discomfort, but I just feel lighter. It's like a miracle. I mean, it's just a totally different feeling.
Tell me about the fear.
Well, I don't really feel the fear right now. You know, it's hard to imagine a life without fear. You know, I guess I'm saying that I keep thinking the fear should be here because it's been with me. It's like it lives in me. And for it to go away is, I'm not going to miss it at all. At all, but it's very strange.
Now I want to be really clear. What you interpreted as fear was adrenaline.
Right.
Okay? That's how we're designed. You encounter a tiger in the woods. You would be stupid not to feel fear. And it's that fear is nothing more than your body seeing a tiger, understanding danger, adrenaline kicking in, and telling you to get the hell out of the way.
Right.
Okay, so the fear is the feeling of adrenaline. You label that as fear. Okay, it's merely adrenaline making this work so you don't choke. All right, I want an overview.
Let's do a swallow chest.
It sounds so much smoother.
I've watched you a couple times swallow, and you've almost seemed like you were startled by the change.
Because it's almost like when I go to swallow, I try to protect myself from choking. Not that I really ever choked to any extent, but that's what it feels like you're going to do. And there's always something stuck in the back of your throat.
So how are you feeling in general right now?
Well, I'm feeling a lot more relaxed. I don't have near the pain. You know, there's maybe some muscle soreness, you know, in my shoulders, but I don't have near the chest pain, discomfort, the feeling that I'm going to die any minute. That awful fear, I don't feel it. I mean, I'm just stunned.